All right, colleagues, good morning. Good morning, and thank you very much for showing up for this session. Thank you for responding to the invitation. Just 3 years ago, on the 5th of March, South Africa had its first confirmed COVID-19 case. And following that, on Sunday, 15th March 2020, on the advice of our health science colleagues, Dr. David Coetzee, Professor Ntobeko Ntusi, and Professor Ruzani Mulaudzi, we announced that UCT's first term vacation would begin early and we send students home. COVID-19 changed our work, it changed our homes, it changed our families, it changed how we relate, and it changed us. And it hasn't been easy. Many of us lost loved ones, friends, colleagues, people we grew up with. And it's possible that even today, many of us are still suffering the loss of loved ones. Who have lost their lives since that time, and maybe connecting with our loved ones in whichever way we do in our cultures who were buried during the time when we were not able to be there for them. Every one of us had to work very hard to make sure that the university keep running. We worked beyond the call of duty to keep the university and the academic project on track, both academics and support staff. Of course, UCT academics had to make sacrifices to prepare to teach remotely, and we completed the year 2020 and we straddled along 2021 under great difficulty, and we are here today. And so before we start with the session, I just want to say thank you to Professor Ntobeko Ntusi, Dr. David Coetzee, and Professor Ruzani Mulaudzi, who advised us on that day and gave us good advice to make good decisions. And since then, they have, together with the COO, Dr. Reno Mora, held our hand through the COVID Crisis Committee, Coordinating Committee, to make sure that we make good decisions, to make sure that everyone on campus is safe. Thank you to them for doing that. But there are also many staff members in the university who made sure that the academic program keeps running. And I want to acknowledge members of the executive who met together. We increased the number of meetings. For the first time, I introduced the extended exec committee that included the deans so that we can make good academic decisions. There is no way the executive, just the DVCs and the VC, could do it alone. It was with the collaboration of the deans that we managed to pull it off. And I want to say thank you to all of you for making it happen. But more than that, there's frontline workers, our UCT staff in the Faculty of Health Sciences, our clinicians who worked long hours. Some of them did not have festive seasons, end of 2020, end of 2021. They made sure that we are safe, not only us in the university, but they served our country. Many of them worked outside their normal roles to make sure that people are counseled, people are supported, patients, COVID patients are supported. And I want to say thank you, a heartfelt thank you from the Office of the Vice-Chancellor and the entire leadership of the university for holding us through this period. Everyone who is in the Faculty of Health Sciences and made time to make sure that not just the university, but everyone is safe. Thank you very much for going an extra mile. Today, we come together because the regulations have changed, but the pandemic is still here with us. Well, the virus is still here with us. And we're calling our experts again to talk to us about where to from here. There's regulations, but there's real life. How do we manage that? How do we continue to be healthy? How do we continue to hold each one of us healthy and strong throughout this period, understanding how to manage it and in the midst of our work? As we send people home, not long ago, I wrote a VC desk inviting you back onto campus. We have missed seeing you, your smiles, your energy, your smells, the hugs, and the uncontrollable laughter. And I hope we can come back to experiencing all of that, because that's what makes us a part of what makes us a community. So now I'm going to hand over to Dr. Renomora, who's chaired our COVID coordinating committee, who will introduce our speakers, and then I'll come back later when Dr. Mora invites me, and then we'll take questions to make sure that all of us, our questions have been answered. Reno, over to you.
Thank you, Vice-Chancellor, and I just want to echo your sentiments of thanks and to the colleagues in the room, our staff, our students, and all our staff who have participated in policy making and panels and shepherding us through this COVID time, a difficult time, but also a time of opportunity. So a real echoing of the thanks that you've given everyone. I just wanted to also remind colleagues in the room of the number of people who've served on the COVID coordinating committee, and my thanks to them for their full participation and helping me and David Coetzee shepherd and advise you as Vice-Chancellor and the executive. I also want to just remind us of the members of the panel who have served this university and answered questions on previous panels. David Coetzee is here, and Ntobeko Ntusi is here, Professor Linda Gale Becker and Associate Professor Tracy Naledi, Dr. Itumeleng and Tatamala have all served on the panels. They unfortunately can't be here for this session, but we do have David and Ntobeko. Ntobeko will go ahead and do a presentation, and I know many people in the room know him very well. Ntobeko is a professor and head of medicine in our Faculty of Health Sciences. Not only has Ntobeko been a frontline worker, health professional, and specialist in the fight against COVID, he's also led teams of people who have served the university, the health system, and the clinical service as well. There's also been strong collaboration in the area of research, cutting-edge research with many staff in the University of Cape Town. And we are very grateful for the contribution of so many people during this time. Ntobeko, I'll hand over to you to do your presentation, and thank you for everything that you've done over the last 2.5 years.
Thanks, Reno, for that warm and generous introduction. And I'm going to be providing a brief update on the state of the COVID-19 epidemic. And over the next 15 minutes, we'll cover 3 areas. One is where we are in the epidemic, the rationale for allowing larger gatherings, as well as the rationale for stopping masking. And then we'll be very happy to join the discussion and answer any questions that you may have. So where are we in the epidemic? In the first 3 waves of COVID-19 in this country, we witnessed high case numbers reflected in this figure in black in the province, associated with high rates of hospitalization in blue, and high rates of oxygen use in green, as well as high numbers of deaths and excess deaths in red. All of these markers of disease severity. And while we saw high case numbers and significant rates of reinfection in the 4th wave, severe disease and death was markedly diminished. And this trend has been sustained in the 5th wave, which recently ended, with lower cases, much fewer hospitalizations, and very few deaths comparatively. In epidemiology, the basic reproduction number, or basic reproductive number, also commonly referred to as R0, of an infection is the expected number of cases directly generated by one case in a population where all individuals are susceptible to infection. The definition assumes that no other individuals are infected or immunized, and ideally the R0 should be less than 1. Once the R0 is above 1, it means the number of cases are increasing as infected individuals are spreading the infection to multiple contacts. Once below 1, it means the disease spread is decreasing because not enough individuals are being infected to sustain the outbreak. And as you can see, the R0 for the province is currently at 0.55. And in the bottom right figure, you can appreciate that in all districts in the Western Cape province, the R0 is well below 1. In this slide, we can see the 5 waves of COVID-19 in South Africa and the variants that drove them. As seen in this graph, with very high R0s, the spread was highest in the original and Omicron waves, but always settles well below 1 in the 3-month periods between the waves. This is an important figure showing that unlike previous waves, where mortality was high and excess deaths were also exceedingly high, coinciding with each wave. In the 5th wave, not only was COVID-19 mortality low, but the number of excess or unaccounted deaths was also much lower compared to previous waves. Driven by the BA4 and BA5 Omicron variants, with higher transmissibility, but not increased virulence, the 5th wave in South Africa has passed with lower case numbers, a relatively mild phenotype, with much fewer hospital admissions and much lower COVID-19 mortality and excess deaths. Importantly, this occurred with no lockdowns and a society and economy that were fully open. Reflecting on vaccinations, in the Western Cape province, nearly 6 million vaccine doses have been administered to nearly 3 million individuals. Therefore, 52% of all adults in the province have now been vaccinated. And importantly, the vaccination rates are highest in older individuals who are more vulnerable. In addition, over 500,000 booster doses have been administered in the province. And while the acute challenges imposed by COVID-19 are clearly on the decline, the long-term effects of COVID-19 are increasingly affecting many people worldwide, including many in our setting, with as many as 10 to 30% of those with prior COVID-19 at risk of long COVID. Fortunately, the incidence of long COVID-19 is significantly curtailed by vaccination, hence another reason to recommend wide-scale use of COVID-19 vaccination. The commonest symptoms associated with long COVID-19 include fatigue, breathlessness, and brain fog. So to summarize, the severity of the COVID-19 epidemic has been attenuated by an increasing proportion of the population having acquired immunity either through COVID-19 vaccination or prior infection. Decreased COVID-19 severity, as evidenced by a much lower rate of hospitalization and mortality rate, has provided the opportunity to modify our response to the COVID-19 epidemic, such that the unintended negative consequences of economic deterioration and social isolation can be eliminated. To this end, the amendments to the National Health Act that regulated the size of gatherings and the compulsory wearing of masks in public places has been repealed. With that background, what then is the rationale for now allowing larger gatherings? Large droplets settle faster than they evaporate compared to small droplets that evaporate as they leave the warm, humid body into cooler, drier external environments, forming residual particulates made of dried material from the original droplets, known as droplet nuclei or aerosols. Even when maximum infection prevention and control measures are enforced, we still see rapid international spread of SARS-CoV-2, suggesting that our model of predominantly large droplet spread may be too simplistic. In fact, emerging evidence suggests that SARS-CoV-2 is spread mainly by the small droplet nuclei. Exhalations, sneezes, coughs aren't just droplets, but primarily comprise a multi-phase turbulent gas cloud that carries forward droplets of continuum of sizes. This may then enable droplets to travel further as warm and moist conditions within the cold cloud may avoid evaporation for longer, thus potentially propelling these infectious droplets further than previously thought, maybe 7, 8, up to 10 meters. This is a lovely schematic from the CDC demonstrating the importance of good ventilation in dissipating these small droplet nuclei that spread SARS-CoV-2. Good ventilation can be achieved by opening windows, doors, using ceiling fans, air conditioners, window exhausts, and air filters. Where there is good ventilation, the risk of infection is substantially reduced. So we can obtain ventilation by using fresh air, filtered air, or flowing air. And these are all opportunities that exist within the university. So to summarize, COVID-19 is spread most efficiently via droplet nuclei, which are airborne and can travel long distances in the air. These droplet nuclei are rapidly dissipated by fresh air, filtered air, or flowing air. Therefore, adequate ventilation is important to minimize infection for large gatherings. Adequate ventilation is extremely important in preventing transmission of airborne infections such as COVID-19. Hence, health facilities, universities, where possible, should ensure ventilation in all areas, ideally with about 6 to 12 air changes per hour. And I've already discussed how we can achieve this. Finally, what is the rationale for stopping masking? Many of us have become so accustomed to engaging with colleagues and fellow members of society whose faces are covered by masks. And there are very good reasons to use masks. Their goal is the altruistic reduction in transmission from people who are mixing in society and shedding virus, either as asymptomatic or pre-symptomatic individuals, as those with symptoms would be safe isolating. And the primary benefit of wearing masks is that they reduce the amount of coronavirus droplets being coughed up by those with infection. And the secondary goal is that they also reduce the load that may be inhaled by those who wear masks. At this point, I need to reflect on the benefits of COVID-19 vaccines, which at the individual level reduce the risk of infection, reduce risk of severe illness, reduce the risk of death, and reduce harmful outcomes with ICU hospitalization. And for individuals who have been vaccinated, they are less likely to transmit COVID-19. At societal or population level, the more a community is vaccinated, the lower the incidence of transmission, new infections, hospitalization, and death. With more people vaccinated, the risk of viral spread declines, and even those who are unvaccinated are then protected. Importantly, vaccines reduce the incidence of long COVID-19, and COVID-19 vaccines reduce transmission, ultimately slowing down each time a virus jumps from one person to the next. And this is important because the less the virus jumps, the less the opportunity it has to mutate. And the less the virus mutates, the less likely it is to evade vaccine-induced immunity. So our current reality in South Africa is that we've seen a substantial decline in the number of reported cases, in hospitalizations, in the effective reproduction number, in population transmission, our COVID-19 positivity rate, and in reported deaths. And as a consequence of these changes, the value proposition of wearing masks in public spaces is not as strong as it was earlier. And these observations led to the announcement by the Ministry of Health that the National Health Act had been amended. So to summarize, currently we have low transmission rates, low numbers of reported cases, low hospitalizations, and low numbers of deaths due to COVID-19. Face masks may help limit the spread of SARS-CoV-2. However, their value proposition is low when transmission rates are low. However, it's important to be mindful that COVID-19 lurks amongst us. And while we are fortunately in a low prevalence period following the fifth wave, COVID-19 remains a significant health risk, especially for vulnerable individuals who are at high risk, or for individuals who are not vaccinated or have not had prior infection. Therefore, the wearing of masks is important as an infection prevention measure in certain individuals. So what are the take-home messages for the UCT community? We need to ensure good ventilation in all of our workspaces and in all of our classrooms. All of us need to remain vigilant. Where we've got symptoms, to stay at home. Individuals who are at high risk should continue to use masks, and we need to encourage vaccination for as many people as possible in order for us as a community to derive the benefits that I've described. Thank you very much. And I wish to acknowledge Mary Ann Davis, Graham Matthews, and Mark Mendelson for sharing slides and their inputs. Thank you, Reno.
Ntobeko, thank you so much for that presentation and also those key take-home messages of ventilation, vigilance, and vaccination. I'm sure that as a team and as a panel, we'll be able to answer some of the questions that our colleagues will be posting, and I'll hand over to the Vice-Chancellor to help us in managing the Q&A session. Thank you, Ntobeko. Vice-Chancellor.
Thank you very much, Reno. And thank you to colleagues for sharing the questions. I'll start with this one from Virginia, who says it would be useful to hear if the big whole class lectures will return. I think they should, especially for first-year students. They need engagement with peers. And yes, Virginia, they will come back. Reno, do you want to talk more to that? I mean, Harsha is not in the room, in the presentation room, the DVC, acting DVC teaching and learning. But we've prepared this morning, we have a PC that went to Senate members that's actually sharing the teaching and learning framework with all of you so that you can give your comments or indicate your views about it. And from there on, we'll publish a VC desk that indicates, of course, that we're going back to teaching. Indeed, our previous mode has affected the performance of our students. Well, of course, also the pandemic. And so we'd like to go back to social interaction, but also digitally enabled education, because we have gotten so much stronger with using digital resources. Please tell us a bit more about the standard of ventilation, Reno, in UCT teaching venues and offices. For example, the kind of filtration used and the number of times per hour that the air is cleaned, refreshed, when the building or venue is used to full capacity.
Thanks, Vice-Chancellor, and thanks to colleagues for that question. Just as a reminder, and I think we have also published the information that we spent in the region of 71+ million on upgrading particularly our big venues, the centrally bookable ones, with our HVAC systems and what we call the HEPA filters, the high efficiency particulate air filters. They do cycle in the frequencies that Professor Ntusi spoke about. And in addition to that, and we will continue to do so, we will monitor the CO2 levels in the venues and make sure that we are compliant with all of those regulations to give not only the executive assurance, but our staff and students assurance that these venues are adequately ventilated. We clearly still face the challenges of some of the old buildings, but our team has, together with an expert group of companies and colleagues at UCT, constantly and continuously evaluating those venues and working with heads of departments and colleagues in the faculties and in those buildings to make sure, as Professor Ntusi said, that where there is adequate ventilation, where there are windows that can be opened, that they are. In those that we consider unsafe or not as safe as others, we do advise on alternative use of venues. But certainly in terms of our filters, we use the HEPA filters. Thanks, Vice-Chancellor.
I'm going to proceed to the next questions. And there's a question that says, what level of mask is recommended for staff and students who are still concerned about the ongoing COVID risk? If the recommendation is KN95S or KF94S, then would it be possible to share a list of recommended suppliers since there are so many substandard products on the market?
I will ask Ntobeko and David to speak about what is recommended. Given what we've done at the moment, we have taken the recommended mask, KN95. We do have supplies, and we will continue to supply staff and students for those who need it, and continue with that practice on a voluntary basis. I think if Ntobeko and David could speak about the overall recommendation around masks. If I could start with Ntobeko and then to David. Thanks, Vice-Chancellor.
Thanks, Reno. So surgical masks or cloth masks are more than adequate protection for vulnerable individuals. KN95 masks have greater particulate filtration and therefore provide greater protection, but for SARS-CoV-2 are probably not necessary. And if you were worried about the risk of infections like tuberculosis, then N95 and KN95 masks would be more appropriate, but for SARS-CoV-2, for individuals who are vulnerable or concerned, a cloth mask or a surgical mask is more than adequate protection. David?
I think just two other points is the mask must fit well and not be floppy, and so if it's a cloth mask, it should still fit well, and I agree it's perfectly adequate if you're not in a medical situation. And the other thing is many people don't have it over their nose, so it should be over the nose and mouth, and that's also a very important point.
So there's several questions about what it means for staff. So someone says, we should not lose sight of the valuable lessons and creative solutions implemented during the pandemic. I'm not going to read the long question, but the person makes the point that our institution prioritizes staff and student mental wellness. So we must note that the Great Resignation has accompanied and forced physical return to work globally. And so the question that this person is asking, together with many other people, are we going to encourage from the center, from HR from the center that way, Reno, policies about blended working at home, online and face-to-face? Is there going to be policies for past staff to be able to work from home? I want to put it broadly like that, because the person is saying they hope that we will not resort back to the old bums in seat from 9 to 5, that way of management. Is there some thinking in terms of how we move forward creatively, taking into consideration what we have learned? Reno? Yeah.
Thanks, VC, and thanks for the question. I think there has been a number of messages and VC and COO desks really encouraging us to learn the lessons of the past, to take what has been good of the past and implement it going forward. So yes, a hybrid work model has been encouraged. In addition, Vice-Chancellor, your last circular spoke about staff engaging with their line managers in order to work out the best and optimum hybrid model. Importantly, what is a challenge for all of us is how do we manage in the new environment, noting that our university is a face-to-face university. Our students receive the best outcome they possibly can in the way we engage with them. Students engage with each other face-to-face. So yes, we will be taking into account the hybrid model. Notwithstanding that, we also need to recognize the value that there is with a university like ours. And I think all the communication does speak to staff working with their line managers to make sure that we deliver the best possible model. It is not one that will simply ignore the benefits of the past, but at the same time, Vice-Chancellor, we must also recognize the nature of our business and what the university means for face-to-face work. I think all of us need to learn to better manage by what we do in terms of outcomes and outputs, and certainly the expression that just having people on their seats is not good enough for a university that wants to aspire to excellence, transformation, and sustainability. So if there's any lack of clarity, we will issue clearer policies, but where we are, it is a hybrid working model, but with staff working with their line managers to decide what is the best for all of us and getting us back on campus as far as we possibly can. Thanks, Chancellor.
Thanks, Reno. I think colleagues should understand that as much as colleagues want the law to come from the top, departments are not the same. And the nature of work that each one of us do in the university is not the same. And it is for that reason that we tasking the heads of departments to think with you, because they know the nature of the work that's done in that department. And they can consider requests for working from home some of the time. It cannot be. It's not like we're running a high school and then everything is the same. There's different kinds of work. Disciplines are not the same. Work are not the same. Whether the department has got cleaners and gardeners and academics and whatever, it's important to consider all of that in terms of how the head of department manages. So we respect the heads of departments and their capacity to lead, and that's why we asking that if you have a need to work from home, or the department should have that conversation and make a decision in that space. Can staff who are immunocompromised request that their students and colleagues wear masks when meeting with them?
I am going to ask if Ntobeko and David can just talk, and particularly Ntobeko, about the sort of international experience on how we manage staff who are immunocompromised, also students. It is a difficult question. While we accept that there is a voluntary approach to mask wearing, we cannot force somebody else to wear masks in the context. But I think there is also a level where staff as colleagues work together and we manage staff's health conditions in a way that is conducive to a good working environment, Vice-Chancellor? So it is a difficult question, but there is not a requirement where a person is immunocompromised to insist that others wear masks. What we will do, however, is work with that staff member's health problem and try and provide as safe an environment as possible. Importantly, we are committed by the Code of Good Practice, which David can speak about, to deal with areas of risk, high risk, low risk, very high risk, and manage staff's health conditions in that context. Ntobeko may want to comment about what happens in the health sector or in the international arena specifically, and I'll ask David if he could speak on the Code of Good Practice in managing staff. Thanks, Vice-Chancellor.
Thanks, Reno. So to answer the question, I'll start by providing a bit of background to the level of risk. So there are certain conditions associated with a compromised immune system. For instance, HIV, in fact, the largest publication showing increased risk of mortality in those with HIV co-infected with COVID-19 came from Cape Town, work led by Andrew Bull and Marianne Davis. And patients with cancer, patients with hematological malignancies appear to be those at greatest risk. At the time when COVID-19 was seen initially, there was great concern that many other forms of immunocompromise, so patients with autoimmune conditions, patients who are taking immunosuppressants would be at increased risk, but large epidemiological studies are replicated all over the world have made that assumption not one that has stood to epidemiological scrutiny. And in fact, the risk for many people who are immunocompromised is not substantially increased compared to the general population. And the recommendation in most institutions is that individuals who are vulnerable for whatever reason continue to wear masks to protect themselves and to protect others should they be at risk of transmitting the disease. But in the current environment where transmission population level is very low, I don't think the institution can insist that other individuals should wear masks because the risk of transmission is indeed very low. If we found ourselves in a situation where we had another significant wave, maybe with a new variant that was driving infections and the risk of breakthrough infections was increased, then I'm sure the guidance would be different. But in the current moment, I cannot see a situation where there would be strong justification for insisting that other individuals should wear masks when they meet with the vulnerable individuals. Thank you, Reno.
In terms of labour and employment laws, the employer is obliged to ensure a safe environment for all their employees. Specifically regarding COVID, there's something called the Code of Practice, and that Code of Practice says that we need to assess all our workplaces and ensure that there's no risk in those workplaces, and secondly, that we have to assess workers to ensure that they are not falling in the high-risk group as described by Professor Ntobeko now. So we need to do that all the time. The people who would be at highest risk in terms of the workplace environment would be those working in the health setting, healthcare workers, and frontline workers, security, cleaners, carers, those sort of people. And obviously the Faculty of High Sciences has to look at those specific individuals and those specific work environments. In terms of the other staff at UCT, the health risk assessments have been done for people who are coming back onto campus, and we need to ensure that they don't work in an environment where there's a high risk of COVID, and that is being done as well.
Thank you very much, David. Ventilation is an important control measure. However, power outages will impact how effective these are. What contingency measures are there for ventilation during rolling Eskom power outages?
Thanks for the question, Vice-Chancellor, and I almost anticipated that would be one of the ones that would come, because it is a concern to all of us. What we have done in terms of dealing with power outages, we are rolling out systematically, and particularly those buildings that we consider as high risk in terms of the risk assessment, temporary as well as permanent generators. It is a process that we have to roll out over a particular period. We have started with that already, and we will continue to do so. We're working also hard to try and find interim solutions. It is not an easy matter given where we find ourselves, but in combination, in making a decision about a large generator, which will take some time to put in place, but temporary and permanent generators that are specific to buildings is the way we will deal with the issue of ventilation. As David has indicated, we have been constantly doing assessments and risk assessments, and we'll have to manage the buildings as we start teaching. It is obviously a challenge, and I appreciate that both the executive management as well as staff and students are concerned, but we are managing it on a risk-based approach. Thanks, Vice-Chancellor.
How do we manage a risk of infection in venues with poor ventilation and where there is no mask mandate?
I think David's input, Vice-Chancellor, was helpful in the sense that we do risk assessments per venue, and certainly our team continues to go around venues and making those risk assessments. We've done a significant number of those risk assessments, and where staff and heads of departments have been concerned about it, our team certainly have engaged them directly. Our commitment is to continue to do that. If David wants to make additional comments, that would be welcome. But we also, on a case-by-case basis, make sure that if there's a request for an assessment, our team goes in to do that, and that's the Occupational Health Service Division in the Department of Properties and Services. Thanks, VC.
Yes, I think all the centrally booked venues have been assessed and okayed or not okayed. And the smaller venues, some of the smaller venues where there's poor ventilation, and there are places like that, the advice has been not to use those venues, the small venues that have got poor ventilation. If there isn't automated ventilation, then windows and doors should be left open to ensure a good flow of air. And there are many such rooms as well, which could be used, but the important thing is to make sure that the flow of air is adequate and that windows and doors are kept open.
Most people I know are not getting tested. So how does this impact on the R rate? Is this factor gained from other sources?
In the first 3 waves, we saw a relatively high use of PCR testing and antigen testing for people who were suspected to be infected. And in fact, by the time we entered the 3rd wave, we started to see a significant amount of rationing of testing, it being limited to individuals over the age of 55, those with diabetes and other comorbidities in the public sector. And increasingly, people have moved away from PCR testing to using antigen tests. And we now have a situation where if people are symptomatic, they just stay at home and not even bother to test until the symptoms go away. We are still able to estimate the R0 by triangulating different sources of information, and we think that these estimates are still relatively accurate, such that if we enter a new wave, we can see the R0 begin to increase. And we can also see the city values, which is a measure of the virus contained in PCR specimens begin to come down, and that suggests that we are in an accelerated phase of the epidemic. And the important point is that we need to have a relatively substantial number of infections at population level for the R naught to be accurate in its estimation. And when the numbers are low, you start to get lots of noise above the population mean. But even in the absence of significant testing, we still have other sources of information that allow us to be able to estimate these important indices fairly accurately. Thanks, Rick.
Thanks, Prof. Santusi. Reno, will HR go back to work?
Vice-Chancellor, some parts of the Department of Human Resources are already back at work, and the answer would be yes, and we are working with the Acting Executive Director, HR, as we do with other managers, to look at the hybrid model and ensure that we get the best possible service within that hybrid model. So people have already returned to work in some areas, and that's a constant discussion. I think, Vice-Chancellor, your point about working with specific areas and determining the best form of hybrid model is applicable to both HR and other departments. So yes to that question.
So someone says masks are still vital. I've been going to campus to face-to-face meetings. However, 3 individuals who were in the meeting are now sick.
The question is important in that one needs to understand that risk is relative. And based on our observations from the last 2 waves, in particular this 5th wave, where rates of transmission currently are relatively low, the risk at population level is also quite low. However, there are still many instances where individuals do get infected, and the risk never goes down to 0. And so hence the recommendation that individuals who are at high risk of significant disease, or those who've been unvaccinated or not had prior infection, should consider wearing masks in the university. When you are in a meeting and people end up being ill, it's often easy to assume that is the source of the infection, but as individuals, we engage with many other people daily where the risk is variable in different settings, and often because of the incubation period before people manifest with symptoms, the infection is acquired much earlier, and just because you were in a meeting with colleagues who got sick does not necessarily mean that they got infected in that setting. But you must also remember that we are in the height of our winter, and unlike the 2 previous winters, we're starting to see lots of influenza, lots of para-influenza, lots of respiratory syncytial virus, and lots of other viruses that cause the common cold or the flu. And so when people are present with symptoms, it doesn't necessarily equate to COVID-19 and maybe other respiratory tract infections as well. So to to conclude, I really think that the take-home message from my slides that all of us need to have heightened vigilance, and where we think we are at risk to continue to use masks, and of course these need to be supported by sound ventilation capacity throughout the institution, and the encouraging of vaccination, so that as a community we've got the greatest level of protection. Thanks, Rina.
I wonder if I could just add, I mean, all our occupational health and safety legislation does refer, our occupational health and safety legislation, and also the code of good practice does refer to the employer doing as much as they can that is reasonably practicable. I think also in the assessment of risk, we do know that the exposure outside of the university may be greater, as Ntobeko has said. If one assumes that you are not attending family functions, social events, all of those sorts of things, and the only area you are coming to and being exposed to other people is the university, then that would be a different scenario to when you are exposing yourself and your family reasonably practically in the way in which you live your life. That then means that the employer has a responsibility to do as much as they can, taking into account that you face the risk of exposure in so many different environments. And I think the spirit of what we're trying to do, and I see it's the flavor of the questions. In some ways, we had the challenge of these questions before, when COVID and our knowledge was not as strong. We still have it now, and I suppose that the appeal is from an employer perspective. We will do as much as we practically can to manage the risk. From a staff perspective, you also are exposed to the virus outside of the university, and working together is really what's going to get us through this transitionary period. We can't say that the pandemic is over, but we can say that if we do, both of us, staff, students, and the employer, work together, we're likely to manage it. Thanks, Vice-Chancellor.
This person says, I have had 3 vaccinations. When should I consider going for the 4th?
Government issues advisories all the time about having boosters. So at the moment, it's advising everybody over 50 to have a booster, their 3rd booster, provided it is 4 months since they had their last COVID vaccination. So the government advisory is coming out all the time that advises on this, and so you should follow that.
Is there a timeline regarding vaccinations being available for children under 12? I still worry about bringing this virus home from work to my unvaccinated children.
So as far as I know, the Pfizer vaccine is now approved for children below the age of 12, and those are available in many centers around the country and our city, and would encourage staff to have their family members, including children, vaccinated.
Why are areas sending out messages to remove social distance markers and return PPE when the code of practice says that measures to reduce transmission must still be applied?
Just to reiterate again, as David and I have indicated, that we continue to do our risk assessments, and our approach generally across the campus is that where we have areas that are more exposed, are exposing staff and students, that we deal with those. I just wanted to ask David if he wanted to speak about the evidence around social distancing, physical distancing, and masks. We're well aware that the regulations have now changed in that regard, but we still, as a community and as a university, will continue to do the risk assessments, and our interventions will be appropriate to what the risk is. David?
We might have all seen the articles that have been written by some of the key people, Mark Mendelsohn and others, relating to physical distancing as well as to wearing a mask. And we live in an environment where for many people this is very difficult. because of the circumstances under which people live. And so wearing of masks, when you read the literature, often what's been written has been about other countries where it's much easier to be able to physically distance because you're not living in a one-room informal settlement or informal housing. Whereas here, masking and distancing is very, very much more difficult to do in our circumstances. And so we need to take that into consideration. And I think that was taken into consideration as well when these regulations were lifted. So although many of us who live in more affluent areas can do these things, a large proportion of the population are unable to. And so this had a lot to do with the considerations about the regulations.
It is a combination of assessing the risks of what we're exposed to outside in the community, and then the risk that we're exposed to here at the university. I would ask Ntobeko if he wanted to comment about the background prevalence and exposure in the community, because while we are on campus, we are members of the broader community where we interact with a whole range of people, not just people from our immediate area of work. Ntobeko, if you wanted to comment about that.
I think it's a really important point to make that the principles we take as a university needs to be aligned with what the exposure is outside of the university. And if we have individuals who are not able to isolate or physically distance in their domestic environs, travel by public transport where it's impossible to physically distance, and then insist to enforce that artificially for the few hours they're in the university. It makes a mockery of how we think about these principles. I mean, in terms of the exposure, Reno, in the Western Cape province, in most communities, seroprevalence rates are greater than 90%, which means that in the first 4 waves of COVID-19, 9 in 10 individuals have had infection to the virus, and so the antibody levels for those individuals are relatively high. And if we look at the current rate of positivity for COVID-19, it's between 2 and 5%, meaning that very low rates of transmission are occurring currently. Hence, again, the thinking behind the repealing of the prior amendments to the National Health Act.
Thank you very much, Ntobeko. Someone says, I need clarification on the voluntary submission of COVID-19, of the COVID-19 vaccination certificate.
Also, I just had a quick look at some of the questions. There are a number of questions that relate to the issue of mandatory and voluntary vaccination. So just to remind our UCT community that we have been encouraging voluntary vaccination, and we will continue to do so. Part of the submission, and that's also voluntary, of the certificate was twofold. One, to get some idea, of the prevalence of our community and how far the vaccination coverage extends. The other, and it was requested by a number of members of the community, is that if we do move, and at that time we were thinking that travel restrictions would still apply, if we did move to a vaccine passport and people needed to travel, that information could easily be available for UCT to assist the relevant travel experience. So there were different reasons for that, but it is entirely voluntary. Importantly, if I could just give a brief indication of the data that we have around vaccination coverage on the surveys conducted in residence with our new cohort of students coming in, the vaccination rates and coverage was over 90%, some as high as 95% in that cohort of staff. In addition, if you look at the Discovery data, that coverage was as high as 68%. And we do understand that in our different risk areas, for instance, in the health sector, and Ntobeko can confirm it, it is slightly lower than 68%. But we have some idea of coverage. At the moment, we don't have absolute numbers, and that was the approach to the voluntary submission of the vaccination certificate, twofold. One, data on coverage, and secondly, also if we had to move towards travel transports, which as I understand it, and I think David and Ntobeko may want to comment, it is unlikely that that will become mandatory going forward. I can't see that happening in the short term. Thanks, Vice-Chancellor. Over to Ntobeko first and then to David.
Thanks, Reno. I don't really have much to add to what you've said, except to reiterate that the use of vaccine passports are problematic for numerous reasons and unlikely to ever be used.
There's a group of people who are concerned that people are coming to office and we continue as if everyone is well. So someone says we have people with bronchial coughs still coming to office and dealing with people face to face. How is this being addressed? Rena, can you talk to us? I mean, there was bronchial coughs before COVID. And now, you know, we can't say now suddenly. I don't know, Reno, can we help?
Vice-Chancellor, I mean, I am appealing to us as a community at large it's part of a caring organization and caring for people you work with. So we are familiar that in the past, let's take COVID aside, when people were not well with what would be a cold or a flu, people would come to the office, not because there was anything bad about it, but because they were committed to continue with their work. But it does mean that you expose others to the kinds of illnesses that are easily spread. And so I think my appeal here, and this is always the challenge and the danger about a Q&A, is that we seem in the panel to have the solutions, but the people out there don't. And my appeal, and I will be interested to get Ntobeko and David's comment, is that actually we are in this health boat together, health and wellness together. And so there's a mutual respect about not exposing all of us in an environment when you may be infected, and it's a co-responsibility. I don't think, and Vice-Chancellor, I think it's unreasonable for the employer to say, well, if you have a sneeze or a cough, thou shalt not come. I don't think that's the culture that we would want in a university or in a community at large. So I think this is a co-responsibility, mutual responsibility, respecting each other's space, and we appeal to everyone in this room and in the community to do the right thing. I wonder if Ntobeko wanted to just comment on that, and then David.
Thanks, Reno. I could not agree more with you. So my appeal would really be for all of us to be responsible and caring organizational citizens. And if for whatever reason you are feeling unwell, to stay at home until you are fully recovered. And we've seen what the risk of spreading respiratory or airborne infections to others can do in driving these outbreaks. And it really is about taking responsibility not only for your own health, but for that of the entire organization. Thanks.
Thanks, Ntobeko. David, would you want to add, given your outbreaks experience and all the work that you do?
Well, I think it's all a balancing act as well. We know the risk is very low, and as Ntobeko showed us, we're not getting a lot of hospitalizations at the moment with the current variants that we have, and we're not getting many deaths and not much excess deaths. So we're taking all that into account, and at the same time, We want to get the economy going. We want to have employment. We want to have the university working as well as possible. And so we're trying to get a balancing act between all of that. And the best way to do it is, at the moment, considering the transmission rate and the effect of is to open up and to have the regulations relaxed. And it's taking those two things into consideration all the time, because we do want to get back to a normal university. We do want to get back to face-to-face teaching, because that is the optimal way to do things. And so I agree with everything that has been said, but we need to think about that as well all the time. And how do we achieve that?
I think that, and you will well remember the Thursday, the 26th of March 2020, when we locked down, as a time where immediately following that there was lots of anxiety and fear, and real anxiety and fear about managing the future. And that was also about change management and co-responsibility. We're now in a situation where we know a lot more, but our fear and anxieties in some ways are still the same about returning or normalizing the university and normalizing South Africa. All of this is about change management. And as a community, if we can't work together to manage the change together, and I think that's David's point as well, is that I think my central message in terms of all of these questions is that at no stage can we decree from your office or the executive about how we do things, but that we do work together in this change management process. And we are always available to be able to advise, and where there are specific areas that need attention, we deploy our people and our resources in order to manage the change. It is about managing the change over the next 3 to 6 months, and certainly the pandemic has not ended. Thanks, Vice-Chancellor.
So there are questions about quarantining, quarantine facilities. We have closed quarantine facilities. We will not be quarantining students or staff or anybody. That doesn't exist anymore. There's also a concern, something about the executive should not trust head of departments with decisions on who works from home and when and so on. I think colleagues, it would be a very sad day if we had managers in the university that you do not want us to trust. You should be worried if there's an environment of no trust, but if you are inculcating it, if you are encouraging it, that we shouldn't trust them, then we have a much bigger problem. We trust our leadership. And as I said, the departments are different. It is not possible that we can make the same rules for a department that has got, past staff, that has got academics and different kinds of academics with different disciplines. There's a good reason why we have heads of departments, and we are going to leave it to them. If we did that, you should know that we're not doing our jobs, because we've got a whole lot of other jobs to do. So I'm going to ask that you allow us to lead together and heads of departments to make those decisions and manage them at departmental level. The executive is not able to manage departments. That's why we have heads of departments. Okay, here's another question, Reno. If we work from home, will UCT monitor us? Example, activating our cameras on laptops, blah, blah, blah. We never monitored people, Reno. Can you talk to this?
No, Vice-Chancellor, I mean, in some ways I'm sad about the question, and in another way, I need to acknowledge that is an expression of an anxiety around management. And so we've never done that in the past. And there's no reason to believe at all that we would even consider doing that in the future. This issue of change management and finding the leadership in our university to assist and work around these issues, I see a number of questions And I know we've come to the end of the session, but what I do want to commit to, Vice-Chancellor, is to establish again a frequently asked questions section to deal with some of the details. But you know, if we're going to go retinal recognition through the laptop camera, it would be a very sad day for our university or for a workplace in general. So the answer is, yeah, it's simply no, Vice-Chancellor, to a question like that.
All right. I want to bring the session to a close. David, is there anything you want to say? Having gleaned on the questions that are there?
No, I've been looking through the questions and I don't think I have anything to add. No. Thank you.
Thanks, David. Tobeko, anything to say, having gleaned through the questions?
Thanks, Vice-Chancellor. I think most of the questions I have substantively been answered. I'm glad that this is recorded and people who have load shedding or are not able to attend can watch it later. But if there are important questions that remain unanswered, I'm sure we can also provide a platform to answer those later.
Colleagues, as we close, let me remind all of us that we are a face-to-face university. We are not a correspondence university. We are not an online university. We are a face-to-face university. And so we're coming back to function as a face-to-face university. Because we are a face-to-face university of adults, of professionals who can talk to their land managers and make different kinds of arrangements to make sure that the work that we need to do is delivered to the standard that we would like to see it as a university. We are not going to change our university into a nursery school where we have a list of rules for everyone to follow up to the letter as to how you sit in class. So we trust ourselves and our colleagues, and we hope that we will make sure that those who have registered with our university to get education face-to-face, they will get value for what they've signed up for. And we will implement the variety of innovative teaching pedagogies that we have designed. I've seen some amazing things that academics are doing. I mean, just to say, I've seen the College of Accounting. It's amazing what you do. And of course, those things are expected to continue with the benefits to students, making sure that there's enough time for them to engage with each other and with the lecturer. And then for our past staff, continue doing your work. We can't do what we do without you. Whether that's keeping our offices clean or our gardens or doing admin work for your department, please continue doing that. Most of that work cannot be done from home. It has to be done from the office. And so I'm going to ask us we do that for our own good. If our university succeeds, each one of us succeeds, we can save jobs and we can make sure that we all thrive in the university. So thank you very much for what you have done, and please join us on campus. Let's go back to being a vibrant university that we've always been. Dr. Kutsie, Professor Ntusi, and Dr. Mora, thank you so much for this session and for leading us as we went through the managing the virus. And I'm sure you'll continue to lead us. If there's anything to update the university, we'll come back here and update us on what next. Colleagues, thank you very much for joining us. Thank you to ICTS and CMD for organizing this. Have a good afternoon.